How was your exam? So this was a basically PYQ loaded exam. And we had done majority of the things yesterday. So my aim is here to show you the relation between yesterday's talk and how you had to get the questions correct. Can we start, please? Are we good? All right. So first question. The last symptom to develop in compartment syndrome is, at many places, the answer given to this question is paralysis. Pain on stretch is a sign. It is the first thing. Pulselessness is not a symptom, it's a sign. So answer is pulselessness, but it's a sign. Dr. P.K. Neat, we will talk about it. Okay. Okay, pulselessness. So we had done this yesterday. Microcirculation is affected. Pulses are normal in compartment syndrome. Loss of pulses is the last sign. Are we good? I hope you got this correct. Question number 2. Which of the following correctly describes the Galeazzi fracture dislocation? So it's a fracture of radius with damage of triangular fibrocartilage complex and lower radial joint. Plus one more thing. Anybody? It has 4 components. One more thing. Interosseous membrane. Interosseous membrane. Okay. Next. So, fracture of radius, number 1. Damage to interosseous membrane, number 2. Damage to disruption of the radial joint, 3. And triangular fibrocartilage complex damage, 4. So these are 4 things. Whereas fracture of ulna with dislocation of the radial head is Montegia. Which is more common? Galeazzi. We had done this yesterday. Okay, beta? A football player had a twisting injury to the knee with no clinical bony injury. Which test has been performed here? Latchman test. What are you testing? Is your tibia going anterior or not? So hyperextension of tibia is prevented by anterior cruciate ligament. So that is what you are testing here. So it is for anterior cruciate ligament. ACL. What is McMurray test for? Meniscus injury. Meniscus injury. What is valgus stress test for? Medial collateral ligament. What is anterior dot test for? Again ACL. But here there will be 90-degree flexion of knee. Where here it is 20-degree flexion of knee. So Latchman test is the best answer here. Okay, friends? So this is something that you should know. Somebody asked me, can you please, sir, explain the ligament? So abhi kar lete. Ye lateral collateral ligament. This is lateral collateral ligament between the femur and the fibula. When you take your leg in a flex position medially, you are stretching the lateral collateral ligament. क्योंकि हम distal part को medial लेके जा रहे हैं, इसे बोलते हैं varus stress test for lateral collateral ligament. This is your medial collateral ligament. When you take this laterally, it's called as a valgus stress test. All right, so it is valgus stress test. So valgus stress test is for medial collateral ligament, MCL. Now ACL, if you in 90-degree flex position pull tibia into hyperextension, anterior draw test for ACL. If you just do the same thing in 20-degree, Latchman test, the image comes. Valgus means distal part laterally. Correct, Bete. Correct, Rohan. When I rotate tibia over femur, the cushions between the knee, the menisci, if they make a sound, it means McMurray test. Because the medial meniscus is fixed to the underlying capsule, it is damaged more than the lateral meniscus. Then there is something called the posterolateral corner. Posterolateral corner is area which has got PCL, and there is something called an anterolateral corner which has got ACL. So there are tests for it. Dial test for PCL. You rotate, external rotate. So PCL basically prevents external rotation. So if the PCL is gone, external rotation will occur. Similarly, ACL prevents internal rotation. So when you're doing internal rotation, if it's gone, it will pull it out. So these are the tests for ligaments of the knee. All right, next. Pain in the hip, which is aggravated while squatting. Steroid use. Steroids in the hip joint with flattening of the femoral head and subchondral cyst means damage to the joint is avascular necrosis. In TB hip, acetabulum also is affected. Fracture neck of femur, patient will be immobile in the bed with external rotation of the lower limb. Osteomalacia will not be presenting like this. Next. So we had done this. This is fracture neck femur image. This is intertrochanteric image. And remember, fracture neck of femur can lead to avascular necrosis, the most common complication. Whereas intertrochanteric fractures causes malunion. We had done this yesterday. We had also done the Gardens classification for neck of femur, Powell's for neck of femur, anatomical classification. The blood supply goes from distal to proximal. More proximal the fracture, more the chances of avascular necrosis. Salter-Harris injuries passes through which zone? Zone of hypertrophy. So the first zone is a zone of resting cells, reservoir. Here you have storage disorders. This is joint, the epiphyseal area. We are talking about zones of physis. At the end is a metaphyseal area. Then you have zone of proliferation. Here growth hormones can affect, like Laron syndrome. Then you have zone of maturation or hypertrophic zone. This is the weakest zone, these two zones. All the fractures they occur through here. Zone of provisional calcification, which is affected in mineralization disorders like rickets. All right, so hypertrophic zone is the answer here. Okay, so this is the Salter-Harris classification. Type 1, 1, 2, 2, 3, 3, 4, 4, type 5, 5, 5. Difficulty lifting his right foot, resulting in dragging of the foot when walking. He denies pain but notes that he frequently trips and is unable to dorsiflex his right foot. Ankle dorsiflexion is not possible. Weakness in dorsiflexion of right foot, same चीज बार बार बोल रहे हैं. Sensation is intact. There is no history of trauma. Patient has to pronounce sitting with his leg crossed. So cross leg kara. So neck of fibula, there is a nerve that gets compressed, peroneal nerve palsy. Classically causing CPN palsy, classically causing the foot drop. बात की थी तो उसको नंबर क्यों कॉल करेगा, ठीक है? Right. This is what you remember, foot drop. Very, very important. So around the knee, cross leg, around the knee. Common peroneal nerve palsy causing foot drop. Why not C? L5 नहीं होगा ना बेटा, radicular pain नहीं दिया उन्होंने. They have not given radiculopathy. So patient has a wrist drop. Question वैसे भी डाल सकते हो. Cock cup split. Sensations can be intact. Sensations can be intact. You know, in any nerve injury, you know, one of the component can be affected. It's known that either motor or sensory. It's known. जरूरी नहीं है सारे fibers affect हो बेटा. It can be just purely motor. Many times in radial nerve palsy also, you will not see much of the sensory loss because sensory loss is subjective. Alright, so very, very important splint. Also remember in this, very important question, posterior interosseous nerve causes, palsy causes finger drop. This nerve is around the radial head. So radial nerve palsy causes wrist drop, posterior interosseous nerve causes finger drop. Answer. ये क्वेश्चन सबका ठीक हुआ हुआ है. Anybody who got this wrong? Bamboo spine, all right? Bamboo spine. So all white areas. Sacroiliitis, inverted knife, 3 bands, trolley track, shiny corner, bamboo spine. They're all ankylosing spondylitis, white. Which of the following is incorrect about PCL? We just did that. It is the main restraint to the interrotation. It's very common, beta. ACL prevents internal rotation. PCL prevents external rotation. That's why in dial test you external rotate. In pivot shift you do internal rotation. Okay, so this is something I've been telling you, very, very, very important. We've done this. Orthodox triad, you know, we have done this yesterday. The dangerous triad is an injury of MCL, ACL, and medial meniscus. Very important. We have questions coming from this area. So, MAM is dangerous. Good. So, distal radius fracture. Stiffness. Skin is now shiny and hot. Pain on touch. Reflex sympathetic dystrophy or Sudex dystrophy. Anybody? Which triad we had spoken yesterday? Langford triad. Wendell meteor. Langford triad. right? Langford's triad. Very nice. Next, bone mineral density increasing screening is recommended after the age of. Anybody who got all first 10 correct? Good. Answer is 65 in females, 70 in males. So here the answer will be 65. Okay, so that's what we have done. 9-year-old child presents your clinic with the following deformity of the right side. So here you can see carrying angle valgus. Here it's varus. Cubitus varus. Which is the most common nerve involved? Ambru. Very nice, beta. Anterior pressure, median radial nerve. And the answer is supracondylar fracture of humerus. We have classifications causing undisplaced, displaced with posterior hinge intact, posteromedial displacement, posterolateral displacement. Type 4 is an intraoperative finding. Right? Cubitus varus occurs in supracondylar humerus. Cubitus valgus occurs in lateral condylar humerus. And lateral condylar humerus with valgus will cause tardial nerve palsy. Next. He complains of difficulty with extending his fingers and wrist. He is unable to extend his wrist or the metacarpal joint of his thumb and index finger, but he can still extend his elbow. Sensation is intact over the dorsum of the hand. Answer will be radial nerve palsy. Correct the answer in the question paper. It has to be corrected. Answer is radial nerve palsy. Question number 13 का आंसर रेडियल नर्व पाल्सी चेंज करवा दो तुम. ठीक है, क्वेश्चन नंबर 13 का आंसर सी करा दो. ओके, आई गॉट इट डन. Let's draw a small table. Radial nerve versus posterior intraosseous nerve. Radial nerve wrist drop, posterior intraosseous nerve finger drop. Radial nerve will have finger drop. Sorry there. Radial nerve will have sensory loss. Normally, yes, cannot be there sometimes. No sensory loss. Since here the wrist drop is there, so the answer is radial nerve palsy. Okay, so I'm correcting it here. Answer is radial nerve palsy. In carpal tunnel syndrome, you will have no wrist drop or finger drop. A 34-year-old man presents to the clinic after a traumatic shoulder dislocation. Traumatic shoulder dislocation. He reports immediate pain and weakness in his shoulder. He has difficulty lifting his arm, particularly in overhead abduction, means deltoid is not working properly. There is diminished sensation of the lateral aspect of his upper arm. They have shown the image here. His biceps and triceps are normal and there is no evidence of any motor deficit in the forearm or hand. MRI is unremarkable, no fractures are seen. Which of the following anatomical structure responsible for the patient's symptom? Axillary nerve damage. Okay. So regimental bas side, axillary. Next. What is the radiographic finding that is given below, which is radiating spicule the bone from a center, often as osteosarcoma? What is it? Sun ray appearance. So you should be knowing all the important reactions. Sun ray appearance, any malignant lesion but osteosarcoma, Codman's any malignant lesion but osteosarcoma, onion peel, any malignant lesion but T-wing sarcoma. Can be there in chronic infections as well. Remember these tables. So if there is a posterior dislocation of the hip, any joint dislocated, closed reduction. Next. Mother pulled his arm while attempting to lift him. Slightly flexed position at the elbow. Crying child. No swelling, no bruising, no deformity. So it's called as radial head subluxation and close reduction is the treatment of choice. Forceful supination. Normally father is the culprit. पहली बार इतिहास में mother पूछा गया. Yes. Deepika correct. Odono triad. MCL, ACL and middle meniscus. Okay, next. It is primary healing because it's plating. All right, so plating, primary healing, no callus. Which of the following will lead to a fishtail deformity? We did this in detail yesterday. Distal humerus fracture. Okay, so that's how the fishtail deformity looks like. So ऐसा लगता है fishtail की तरह. Okay, fishtail deformity. Distal humerus fracture. Next. Which of the following? First 20 में से किसके 19 correct हुए हैं? 19. Which of the following are true regarding open fractures? Compartment syndrome is rare. Immediate debridement should be done. Tibia is the most common bone involved. First three are correct. Multiple fractures are common. 1, 2 and 3 are correct. कल बड़ी डिबेट हुई थी इसके अंदर. तो ऑस्टियोपोरोसिस में it is just to rule out अगर कैल्शियम फॉस्फेट ALP are abnormal then it's not osteoporosis. Let us do the Gustlow-Anderson classification. Grade 1 is a wound less than 1 centimeter. Grade 2 is a clean wound but 1 to 10 centimeter. Grade 3A is any comminuted, contaminated, gunshot, or farmhouse injury with coverage of bone. Still after debridement, the bone is covered. Grade 3B requires soft tissue coverage, means you need to provide skin graft, muscle plaster. Grade 3C is anything which has a vascular injury. So, if I look at the question, distal pulses are diminished, so it is grade 3C. Eighteen-year-old, how will you prove? Knee and wrist. 18-year-old. We had done this, okay? Which of the paling is required for OK sign or wow sign or kilonewton sign? Flexor pollicis longus. Flexor pollicis longus. It's required. And FDP lateral half. FDP lateral half. Both are supplied by anterior interosseous nerve. डी नहीं होता बेटा. Epiphyseal injuries causes fluid disturbance. We had done this question yesterday. Damages the anterior column, middle column, posterior column. Everything gone. Chance fracture, jackknife, or seatbelt injury. Okay, Jefferson is burst fracture of C1, Jart. Hangman is C2 over C3. Whiplash is hyperextension for flexion. Teardrop is anteroinferior damage. Burst is anterior middle column gone. Wedge is anterior shorter than middle column. Chance fracture, anterior middle posterior column all gone. Motorcyclist fracture is separation of skull into anterior posterior halves. Chance fracture can cause neurological deficit, no doubt about it. What's this? Lower end radius, lytic lesion going to the bony end, the joints. Giant cell tumor. There's no other tumor which can go right to the joint. It's the joint which goes to the joint, also called osteoclastoma. They can show you lower end radius, upper end tibia, upper end femur, but the commonest site is of GCT is lower end of femur. Huh? The earliest way to take the development by a nurse in a patient with a cast is decreased response to analgesia, pain out of tolerance, pain out of proportion to the injury is earliest symptom. Proximal pole of scaphoid is the most common bone to undergo AVN. This is correct. Blood supply is retrograde. This is correct. Answer is A. कल वाले क्वेश्चन को घुमा दिया है मैंने थोड़ा सा. Thirty-one. बेटा वो इस क्वेश्चन में प्रॉक्सिमल पोल का मतलब है विच पार्ट ऑफ स्केफॉइड. Correct. Proximal pole of scaphoid is the most common part to undergo AVN. Okay, that's correct. It doesn't mean that it's comparing between the bones, it's the part that is there. So there is restricted internal rotation, unable to bear weight. All right. Tenderness over the right hip with reduced movement, absent movement नहीं है. The transient synovitis. Absent movement is septic. Perthes is not painful. SCFE is second decade with hypothyroidism. Transient synovitis. So in transient synovitis, non-toxic decreased movement, septic is toxic with absent movement. Transient, self-resolving, septic, surgery and antibiotic. ALP was raised normally in osteoporosis. It's not raised. They want to know marker of bone resorption कौन से होते हैं. So answer is tartrate, raised acid phosphatase. What are the markers of bone resorption? Let's have a look. Trap, C-terminal telopeptide, N-terminal telopeptide. Whereas marker of bone formation, alkaline phosphatase, osteocalcin, procollagen, C and N-terminal. Okay. All these markers are increased in osteoporosis because there is more resorption of the bone. Similarly, there is a FRAX or the fragility score in osteoporosis which has 12 factors. You must remember that it has come in exams. Age of the patient, sex of the patient, weight of the patient, height of the patient, previous fracture because of insufficiency in the patient, parental hip fracture, smoking, alcohol, bone mineral density going down, secondary osteoporosis, rheumatoid arthritis, and glucose use. Glucosteroid use means steroid use, glucocorticoid use. So these are 12 things which are there. All right. And there's a questionnaire for these points, and then to calculate the chances of fractures called as FRAX score. This is very commonly used in USA. What is the given instrument used for? It is the bone holding forceps used for holding the bone fragments while fraction. It is bone holding forceps because इसके अंदर tooth है. Wherever you have tooth, that's a bone holding forceps. Risk factors for fractures and osteoporosis. FRAX score. FRAX score. Assessing the fracture risk. Please app में ये पूरा PDF upload कर देना. Right? This will be uploaded, okay? Because bone plate holding forceps नहीं हो सकता. Bone plate में plate holding smooth होता है. One end is smooth, okay? So here you can see that. ये रहा. Rough, smooth. This is bone plate holding. Haglund deformity is around the ankle. That's Haglund's deformity. True statement in view of septic arthritis. Widening of joint space is there. True. Staph is the organism. True. You need to operate all. True. Poachers is used for differentiating from transient synovitis. True. So all are correct. Poachers criteria 4 होते हैं बेटे. Patient is not able to bear weight with the limb. Temperature more than 38.5 degrees Celsius. C reactive protein or ESR high. WBC, that is TLC count more than 12,000. 1 point positive, 3% cases. 2.40% chance of. चलो ठीक है, डन बेटा. आज ये वाला PDF टेलीग्राम पे डाल देना. एक बात सुनो, मैं तुम्हें दे रहा हूँ गिफ्ट. ओके, अष्टमी है, मना नहीं करूंगा. और वो भी एक कन्या ने मांगा है, संज्ञा ने. कैसे मना करूंगा? अष्टमी का दिन है. एक तो रिएक्शन बंद किया तुमने. ना कोई दिल है, ना गुस्सा है, ना हार्ट है, ना कुछ है. सात दिन बाद फास्ट खोला है मैंने आज. पहली चीज मांगी है किसी ने, कैसे मना करूंगा आज? ऑलराइट, ओके. सो डल जाएगा. बट उसमें बेटा एक चीज का ख्याल रखना, वो एक क्वेश्चन का आंसर चेंज किया है, मुझ पे इल्जाम मत लगाना. ओके, उसको मैं अभी फिर एंड में क्वेश्चन को ठीक कर दूंगा. ठीक है, आगे बढ़ते हैं. If the 3 points are positive, 97%, 93% positivity, and 4 points, 97% possibility of diagnosing septic arthritis. Next. All right, 45-year-old man with history of diabetes, present with pain and swelling in the foot for 3 months. Diabetes आता है ना बेटा, तो आपके मन में आना चाहिए फ्रोजन शोल्डर, डुपिटल्स कॉन्ट्रैक्चर, चारकॉर्ड जॉइंट, डायबिटिक फुट. ओके, एक्यूट ऑस्टियोमाइलिटिस नहीं आनी चाहिए, chronic नहीं आना चाहिए. Right? He reports that the pain has been gradually worsening. Open wound at the bottom of his foot that has been draining purulent material intermittently. He had multiple episodes of foot infection. ये पूरी कहानी है. All right. There's a foul smelling wound with surrounding erythema, and the patient has tenderness over the metatarsal bone. Patient revealed bone sclerosis, cortical thickening in the affected area. Which of the following is the most likely diagnosis? So diabetic neuropathy with a foot ulcer. That's the answer here. बेटा क्लासिकल डायबिटिक फुट है ये. क्लासिकल डायबिटिक फुट. ओके, डायबिटिक न्यूरोपैथी. आंसर ठीक कर देना अगेन. तो आंसर इज गोइंग टू बी डी. ओके, रॉन्ग इन एप. वो ठीक हो जाएगा बेटा, आप यहाँ पे रहो. दैट्स ओके. डायबिटिक फुट के अंदर इट इज ऑटोमेटिकली अंडरस्टूड दैट दीज ऑस्टियोमाइलिटिक चेंजेस विल बी देयर, बट इसके अंदर विद फुट अल्सर, नॉन हीलिंग अल्सर है, न्यूरोपैथिक जॉइंट्स. Sparing of DIP, morning stiffness. What do you think is the answer here? Rheumatoid arthritis. Classical ulnar deviation of the fingers can be seen. Okay, so we remember all these points about different joints. What's your diagnosis here? देखो कल की क्लास अटेंड करिए तो पकड़ में आ गया. ये रिपीटेड एमसीक्यू है बेटे. पेटलर फ्रैक्चर. Again, yesterday's class. Waller Braun splint. Femur fracture after 2 days. Breathlessness, fat embolism. GERD criteria is used. Okay. We had done this yesterday. GERD criteria is used. Next. Cupping, splaying, flaring. Can be painless, can be painful. Diabetic ulcers. Usually painless, can be painful as well. This is what I want you to discuss, right? Calcium is usually normal in all the types of rickets or maybe low, but normal to low calcium. So calcium differentiating नहीं होता. Phosphorus सब में कम होता है except for the renal rickets. Hypophosphatemic rickets, PTH is normal. We had done this question yesterday. ALP is always high. Brinda and Aparna can have sclerosis in the bone, no problem at all. Diabetic foot can have ulcers, and there can be sclerosis in the bone. It can be there, with you. So these are the features of rickets and osteomalacia. True statements about fracture shaft of femur. More common in elderly. It's not. It's more common in young. Gallows traction is for less than 2 years. Also not the treatment of choice because वहाँ पे भी spike होता है. Yes, associated with pulmonary complications. That's true because fat embolism is there. Nailing is the gold standard of femur except for the head and neck. Correct. C and D are correct. What is the most common pattern of involvement of TB spine? Paradiscal. It's important, very important question. Simple है, ये गलत नहीं होना चाहिए. Two, vertebral involvement is tuberculosis. Again, this we had done yesterday. Normal calcium हो सकता है, PTH high होगा, low phosphorus होगा. This is the answer here. Now it makes sense, ना? हमने करा था. कल के PDF में this table was not there. I was missing it yesterday. It should have been there. I'm really sorry for yesterday. Indications of surgery in a patient with pot spine to establish the diagnosis. Operate, it's worsening. Again, to get that tissue for diagnosis. Cold abscess without deficit is not an indication. Okay, this is middle class element. Bowel bladder involvement, worsening, no improvement. Okay. What's the diagnosis here? Galeazzi fracture. Right, good. Next. Answer. Moon shaped face. ये तो आपको डॉक्टर जैनब ने पढ़ाया होगा. Zainab would have taught you. Marble bone disease, also called as osteopetrosis. Very good. Next. So this is all marble bone disease. Next. Sir. Recent sign. Answer, avascular necrosis. Osteogenesis imperfecta, I'll go for a bone scan to diagnose multiple fractures in the body. 49. Squares of Swansea. Very nice. Well, there is extension at elbow, which is a very important thing. Pronation of forearm and interrotation of shoulder. So policeman or waiter tip deformity. This is what they say. Two important things which are not there are shoulder abduction, elbow flexion. Two most important movements to get back. Hemiarthroplasty. Let me just announce the results. People ने भूत फोड़ा है. हालांकि दो क्वेश्चंस के आंसर्स ठीक होने, एक डायबिटिक फुट वाला और एक रेडियल नाप पालसी वाला. बट एनीवेज उसके अलावा 48 क्वेश्चंस हैं. इन महानुभाव के लिए ताली बजाएं. इससे पहले मैं आपको एक बहुत सुंदर स्टोरी बनाना चाहता हूँ. उदित नारायण महापात्रा. 50 में से 50 करेक्ट, अगर वो दो आंसर मान लें. क्या वो यहाँ पर हैं? उदित जी आप यहाँ पर हैं? यस और नो बोलिए. दानिश्मा, अगेन 50 करेक्ट. नीट INI, जिसमें आई कैपिटल है पहले वाला, दूसरा छोटा, 49 करेक्ट. के कैपिटल स्मॉल वी, KV, 49 करेक्ट. रजत शर्मा 49 करेक्ट. नीट INI, इसमें दोनों आई छोटे हैं, 49 करेक्ट. श्रुति आनंदन 49 करेक्ट. ANN, दोनों एन छोटे हैं, 49 करेक्ट. एनोनिमस 49 करेक्ट. सत्या द ट्रुथ 49 करेक्ट. डॉक्टर अनिंदा बिद 49 करेक्ट. डॉक्टर PK नीट 48 करेक्ट. सोहेयो 48 करेक्ट. ऋत्विक 48 करेक्ट. अंकिता धिमंजी 48 करेक्ट. श्रुति मैम 48 करेक्ट. नारायण जोशी 48 करेक्ट. संदीपन देव 48 करेक्ट. मुस्कान तिवारी 48 करेक्ट. Shinchan ji 47 correct. That's all. So the story for today is very simple. It talks about respect. Right. So I just want to talk about something which makes a little sense to you students at this moment of time. And you know, I heard this on net and I thought that let me tell you why it's so important to listen to your seniors and teachers in life and respect them. It's a different spectrum, but I think this makes sense here when people have a feeling in this life that Apunich Bhagwan hai. So this talks about something opposite to it, right? So I've been telling students for a lot of time that let's stick to the basics. Let's not try to do too many things. जो आया है वही आएगा. जब हमको समझ आएगा तो हमारा नंबर आएगा. Common things are commonly asked. If you mark them, you're commonly selected. Rare things are rarely asked. If you go for rare things, you're gone. Keep things simple in life, do not complicate. रिश्ते, जिंदगी, एग्जाम जितना सिंपल होगा उतना अच्छा होगा. It's very important. So this dates back to the story of Mahabharata. And एक बार एक श्राप मिला. There was a curse given to the Pandavas that Arjuna would have to kill one of his brothers. All right. And so Arjuna had to think that how will I do that, right? So what Arjuna did was Arjuna said that Shri Krishna, who was the mentor for them, he said that you go and Yudhishthir, who is your eldest brother, also equivalent to your father, right? Go and insult him in the public. So he says why? He says because it has been given there that if you insult your seniors, your teachers, your fathers, your elder brother, right? If you do that, right, it's almost equal to killing your senior, your father, or your elderly patient, anybody. So he goes there and he says, if you would not have played this gamble, if you would not have done this, neither we would have gone to the forest, neither there would have been the Draupadi Chirharan, neither there would have been this war. So you are responsible. So Shri Krishna said, that's enough. Now, this is what you should understand. If you do not listen to your seniors, your parents, your family members, your teachers, you are actually doing harm to them and to yourself. Now, Arjuna had this feeling that I have insulted my brother, my elder brother, who's like my father, who's been my mentor, who has taught me everything. So he came back to Shri Krishna and said, how would I punish myself now? And here comes the second line, which is very important. Sri Krishna said, now go and tell the world you have done something great. You are the boss. He said, why? He said, because it's given there. Once you are into self-appraisal, you start praising yourself, you are killing yourself. And that's the point here. So Arjuna went and said, a lie. I am the greatest warrior. And the Sri Krishna said, you are not, because Karna is the greatest warrior. So the moral of the story is, if you do not listen to your teachers, your parents, your seniors, it's almost like finishing off the generations who are your mentors, your guides. And when you start thinking that you are the boss, you are the king, Apunit Bhagwana, you start killing yourself. So self-appraisal is like suicide. So do not go into self-appraisal. What is more important is to understand with reality. आपके अंदर ये feeling होनी चाहिए that yes, I am going to be humble and I am going to learn. Right? जितने भी भरे लदे पेड़ होते हैं वो हमेशा झुके होते हैं. जितने भी बड़े लोग होते हैं वो चुपचाप रहते हैं. इवन हमारे सीनियर्स को देखिए इन सेरेब्रल एकेडमी और कंसेप्चुअल ऑर्थोपेडिक्स एवरीवेयर. माना है चुपचाप खड़े रहते हैं. जो बड़े होते हैं वो बड़े होते हैं. हमारी महफिल सस्ती है जिन लोगों से उनके कदमों पे कई ताज पड़े रहते हैं. So this is what you need to understand. Be humble. Right? जिस मोती में दम होता है वो अपनी कीमत खुद नहीं बताता, दुनिया उसकी बताती है. It's very, very important. You need to be grounded. ये वो टाइम नहीं है एक एग्जाम में मार्क्स आए खुश होके बॉस बन गए, कुछ नहीं होना उससे. सिलेक्शन होगा तब होगा जब आप ये समझेंगे यू हैव टू कंटिन्यूअसली कीप ऑन गोइंग. एंड एंट्रेंस की पढ़ाई तब तक नहीं होती जब तक एग्जाम होता है, तब तक होती है जब तक आपको आपके मर्जी की सीट नहीं मिलता. It is very, very important that you stay grounded till the time you get what you finish. It's just not, what's your final aim? Is your final aim getting an MBBS seat? I don't think so. What's your final aim? Is your final aim getting a postgraduate seat? I don't think so. Is your final aim to serve the patients and decrease the disease burden, decrease the agony that the world is living with? That's what it is. Your aim is to be a human first. So the बड़ा बने ना बड़े पता नहीं, right? एक बड़ा अच्छा कबीर का दोहा है, उसने बोला है, बड़ा हुआ तो क्या हुआ जैसे पेड़ खजूर, पंछी को छाया नहीं पर लगे अति दूर, पर लगे अति दूर. So what is the point in being so big? Neither you can feed a person, right, nor you can give the shelter, right? This is very important, and that is why you important, right? पंछी को छाया नहीं फल लगे अति दूर. All right, that's good. Suman. Okay, so let's focus, refocus, get started. जिन लोगों को ये लगता है कि 2 महीने में कुछ नहीं हो सकता वो गलत सोचते हैं. जिन लोगों को लगता है जो अभी टॉप कर रहे हैं वो एंड तक टॉप करेंगे, गलत सोचते हैं. जिन लोगों को लगता है कि मुझे सिर नीचे रख के रोज मेहनत करनी है, वो ठीक सोचते हैं। यहाँ पर कुछ लोग हैं जिनके 46 to 50 के बीच में मार्क्स आए हैं, उनको भी बहुत मेहनत करनी है। उन्हें मेंटेन करके रखना है, क्योंकि अब फॉल हो सकता है। जिन लोगों के 30 से 46 के बीच में आए हैं, उनको चिंता नहीं करनी, उनको आगे गेन करना। It's a continuous process because my teachers tell me, right, that you need to understand that every effort to learn every day is an investment onto yourself being a better person than yesterday. Over to the next class at 5:30. Till then, thank you very much. All the best. और अच्छे बच्चे।